The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Today on Aging Horizons, we'll be getting a Medicare 101. Kimmy Everman's going to be with us to answer all the questions that I know we all have. What is Medicare? How does it work? Who's eligible? And how do you know what benefits you're going to be receiving under Medicare? So you're going to want to make sure you stay tuned to today's Aging Horizons with Kimmy Everman.
Summer in Montana is a great time to visit your local farmer's market. Enjoy the social atmosphere while shopping for a wide variety of fresh, locally grown produce. Together with both WIC and Senior Farmers Market nutrition programs, you help feed your family 5 or more daily servings of fruits and vegetables for better health. You also help local ag producers and enhance the state's economy. So, for summer fun that's nutritious and helps Montana's economy, shop at your local farmers market.
"45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up. I lost it all. I knew smoking was expensive, but I never thought it would cost me everything."
The human heart. Even at its strongest, it's a fragile muscle. Chest and arm pain, shortness of breath, are signs of a heart under attack. But 3 numbers can save a life. Dial 911 at the first sign of a heart attack. Quick response from medical experts can save your life.
I was 45 and it happened to me, a heart attack.
Dialing 911 saved Ryan's life. Now he's here and he's healthy.
This message sponsored by Mission Lifeline Montana.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Welcome to Aging Horizons. I'm your host, Katie Lovell. Aging Horizons is brought to you by the Department of Public Health and Human Services. And today we're interviewing Kimmy Everman, who's a program specialist with the department. Kimmy, thank you for being here with us today.
You're welcome.
So today I thought we would just do a Medicare 101. We haven't done one of those in a while.
Right.
And I know that in between each segment, I forget.
Yep.
This is a complicated program. So tell me, what is Medicare?
Okay, well, let's start by just identifying that Medicare is federal health insurance that, and it comes to folks who are 65 and older, for the most part. Some folks who are found disabled by Social Security criteria may get Medicare earlier. And in order to get it just at 65, you need to have worked 10 years of full-time work or employment. It's also known as 40 work credits. And it just really can be all over the place. And this is really important for, say, mothers who maybe didn't work for a little bit while they were home taking care of kids and then went back into the workforce. It can be all over the place as long as it is equaling 10 years.
So you could have worked a few years right after high school, a few years after college, or in your 20s, and then again maybe in your 40s.
Right, exactly.
Okay. Great.
Yep, exactly. And that all counts towards getting you eligible for Medicare. So at 65, you're going to get that, and for some folks, that full retirement age has changed to 67. You still get Medicare, at least in 2019, you still get Medicare at 65.
Okay.
I don't know that it's going to change. I don't mean that, but we want people to realize that They don't have to wait all the way until their full retirement age. So that's how you get it, and it comes through the Social Security Administration.
And how do you know that you're going to be eligible? I mean, other than turning 65, are they going to remind you? Are they going to send you any information?
Yeah. They're going to send you, you know, over the years we've kind of heard hit and miss, but what I understand happens really frequently now is you get something in the mail from Social Security 2-3 months prior to your birthday, your 65th birthday, and actually probably 3 months prior, because the signing up period when you're first eligible for Medicare is 3 months before your 65th birthday, the month of your 65th birthday, or 3 months after. So you get a total of 7 months to actually enroll. But even if you don't get something from Social Security 3 months before your 65th birthday, you want to start thinking, I should sign up. Then the minute you turn, well, the minute your birthday month comes, you're covered by Medicare.
That's great. That's great.
And even if your birthday is, say, the 31st of that month, you still get Medicare the first day of that month.
That's wonderful. So somebody who's like my birthday is the end of December, so I would be covered starting December 1.
That's right.
And I could start looking at signing up early in September.
That's right. And the thing about waiting is, for one thing, I think waiting can get worrisome for folks, so do it as soon as you can.
Sure.
But also, if you wait after your birthday month, your Medicare will start a month later. So you want to make sure that you're not losing coverage even for a month or two.
Okay. And Medicare is broken down into pieces, is that right? And there are four, am I correct?
Parts, yeah. Part A, Part B, Part C, Part D.
Okay.
Part A is hospital or major medical. Part B is outpatient. Part C is what's referred to as Medicare Advantage or the Medicare health plans.
Okay.
Part D is the RX coverage or the prescription drug coverage.
Okay. And does a person have to have A, B, C, and D?
No, there's a number of ways that a person can get their Medicare services, and I want to take this opportunity to say, call a SHIP counselor. Let's put their number up on the screen. They're the ones who can really help you walk through this kind of maze.
Okay.
And they'll help figure, based on what you say you want, they'll guide you through comparing plans and talking about prices, networks, you know, etc.
Okay. So Part A is the part that's going to come for free. Everyone gets Part A.
Right.
And then
and really, it's that you've worked for all that time.
Right.
You've paid in advance, so you get that no matter what.
Wonderful. And then the Part B, that's what people think of as like traditional insurance, your inpatient.
Well, no, that's actually your outpatient, where you're going to the doctor, you're having lab work done, you know, things of that nature. Part B is what people use pretty much on a daily basis.
Sure. And then that Part D, those are those prescription drugs, and that's so important.
It is. And we really want folks to know that one, you need to look at that every year and make sure that you're in the right plan, because those plans can change. They may drop medications, they may change prices, they may change rules, whatever it is. You always want to look. Maybe none of that happened and you're real happy with your Part D plan. That's great too. You can just stay in it. But we're right at the time now, at the end of summer, where folks should be thinking about that, because open enrollment comes in October.
Sure. So B, C, and D parts of Medicare will have premiums that people need to think about, correct?
Exactly. Part B, the premium is $135.50 in 2019.
Okay.
And then there's a $185 deductible for the year. Part C, you're going to have those, but because you're getting a Medicare health plan, the structure may be different.
Sure.
And then with Part D, it could be any amount.
Wonderful. So when we come back, there are helping programs that can help you cover those costs, correct?
Yep.
Great.
We need to talk about them.
Wonderful. So stay tuned. You're not going to want to miss our discussion of those helping programs that may help you cover those costs that Medicare isn't going to cover.
Every generation produces heroes, men and women who step forward to defend our country in time of need, no matter the personal cost to themselves. And though we can never fully repay them, we can make sure they have access to low-cost, long-term care when they need it. That's what Montana's Veterans Homes are all about. If you've got a hero in need in your family, call us. We can help.
In Montana, we know all about responsibility and personal accountability. Don't pay another medical bill that you don't understand. Take charge. Review your medical bills and call your provider right away if you have questions. If your bills are too confusing, call Montana SMP, the Senior Medicare Patrol. Call 800-551-3191 and get connected directly to a local office. Call Montana SMP today.
This is Sergeant Jones. Please respond. I was separated from my squad. Requesting backup. Anyone? Please respond. I'm all alone here.
Gentlemen, this is a secure federal facility. Do you have your Montana Real IDs?
ID. I am Captain Lewis, and this is Captain Clark.
I'm sorry, I can't let you in.
Can't go into a federal facility, can't fly. Let's go back to the river.
Yes, we'll float home. Let me check the Google. What's a dam?
Discover more at mtrealid.gov.
Montana Real ID. It's the real me.
Welcome back to Aging Horizons. Today we're speaking with Kimmy Everman, who's a program specialist, and we're doing a Medicare 101 section. So, Kimmy, I know we've just gone through the programs, but Part C always gets me. I always seem to have a little bit of confusion. What is it and what does it do?
Well, you know, you're not alone, Katie, because it is kind of confusing. And part of the reason is because prior to Medicare modernization in 2003, we didn't have these kinds of plans in Medicare, or at least in Montana. Medicare Part C is what's referred to as a Medicare health plan or a Medicare Advantage plan, an MA. And it is a plan of Medicare benefits that is being offered by a private insurance company.
Okay.
So for sake of conversation, we'll say Blue Cross Blue Shield because everybody knows them. If you're getting an MA from Blue Cross, that means that they're giving you all the services that you are eligible for as a Medicare beneficiary, but they're doing it through their private system, and they may be giving you something extra in benefits, sort of like a little bit of dental or maybe some vision, giving folks, health club membership, sorry about that, has been very popular. So it might be something like that. And you not only get all of that, but you also usually get your prescription drug coverage as well.
Okay.
So we've called it a one-stop shop for a long time because everything is kind of rolled up into one. You may pay an extra premium to be in it. If folks remember, I said for Part B, you pay a premium each month. In 2019, I'm $135.50. Well, that still has to be paid, even if you're in the Medicare Advantage plan. So somehow that gets paid either through you or through a behind-the-scenes source. But there might also be another premium just to be in the Medicare Advantage plan.
Okay.
And having said that, it's just crucial that people look at those things every year and make sure they know what they're getting. The premiums aren't going to hurt unless you can't afford it.
Sure.
And if you don't know that, you're locked in for a year if you sign up. So we want to make sure that people are always looking at those things. Medicare Part C and the drug Part D are very important to look at every year. Again, those SHIP counselors, they're awesome. We're going to put up that number and just give them a call, and they can help you walk through this.
So just so I make sure I understand, someone is going to have a Medicare Part A. Everyone has Medicare Part A.
Right.
And you would have either a Part C or a Part B. You likely wouldn't have both.
Well, right, exactly. And Part C is a conglomeration of all the others.
Right.
But yeah, you wouldn't have that. You either have one or the other. And it's referred to as the traditional model. If you have A, B, and D, that's the traditional model.
Okay. I think I'm finally starting to understand Medicare, Kimmy. After all of these shows, I'm finally getting it. So those premiums, like we talked about, especially can start to become a strain on families.
Yeah.
But there is help out there. There are programs that help.
Yeah.
Let's talk about those.
Well, I'm always happy to do that because I think these are such great programs. The first that I like to talk about is the Medicare Savings Program, or MSP. And that is specific to your Part B, that outpatient coverage. It is in levels, so you might make a little bit more money and still be eligible, but there of course is eligibility criteria, and if you are found eligible, it might pay deductibles, co-pays, out-of-pocket expenses that might be, as you said, become a strain. Apply no matter what, find out. It can't hurt to apply, and you just call a SHIP counselor and they can help you do so.
Wonderful.
The next one is called the Low Income Subsidy, or LIS. People also probably have heard of it as Extra Help, and it is specific to Part D, which is that prescription drug coverage, and with that help, it helps again pay for co-pays and deductibles and maybe out-of-pocket expenses that would become a burden after a little bit of time. And also with that plan, there are different levels of eligibility. So if you're not eligible for one level, you might be eligible for another. Try.
Sure.
Call a SHIP counselor. They'll be happy to help you. And then we also have a great Montana program called the Big Sky RX program. And that one is specific to Part D again. It pays a premium, a monthly premium on a drug plan for a person. There are, again, some eligibility criteria, but it's a much more fluid extra help for folks. So you might make a little bit more, and they don't care about your resources. So you can have a house and a car and things like that, but in Montana we have people who are land rich and cash poor all the time. So those are fabulous programs to go along with Medicare, and of course Medicaid. We see many folks in SHIP that are Medicare, Medicaid beneficiaries, and if that is you, that can be a real challenge. For a beneficiary. So again, call a SHIP counselor and they're happy to help walk you through that even bigger maze.
Absolutely. Those SHIP counselors are just so important all
They
across
really
the state.
are. They really are. And you just have to call that number. You can either talk to them, leave a message, whatever. They'll get back with you. And it's confidential, always.
Absolutely. Kimmy, thank you. When we get back, we are going to talk about some of those extra services you might not know that Medicare covers, some of those preventative benefits. So stay tuned. You're not going to want to miss this.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Questions about Medicare and other types of insurance? Contact the State Health Insurance Assistance Program office to get answers to questions like, what is the difference between Medicare and Medicaid? And how do you decide if you need Medicare supplemental insurance? This insurance counseling program is not a sales program. It is available to provide answers to your insurance questions. For more information, call the State Health Insurance Assistance Program office at 1-800-332-2272.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
Welcome back to Aging Horizons. Today we're speaking with Kimmy Eberman, who's a program specialist with the department, all about Medicare. We're doing a Medicare 101. So Kimmy, thank you again for joining us.
Sure.
Thank you for explaining Part C to me again. I
Sure.
really appreciate it.
Sure.
So we've talked about those helping programs. Now let's talk about some of the benefits that I think a lot of people don't know that Medicare covers.
Right.
Let's start with that enrollment visit.
Right.
What is this?
Well, Medicare offers preventive and wellness benefits because, and as a person who's worked with Medicare for going on 25 years, I've seen them come so far to this place where they want to be proactive.
Sure.
And that's the whole point of these health and wellness kinds of benefits. Get it before it's so terrible that nothing can be done. And that Welcome to Medicare visit that you just mentioned is a great example of being proactive. It has to be done in the first 12 months that you're in Medicare. And it is a chance to visit with your physician, and it might be different than what people are thinking. So let me just explain a little bit about this visit. It is more of a baseline building visit than I always think about, getting my knees tapped with the little hammer. They're not going to do that probably. But what they're doing is asking you family history questions. They're asking you cognitive kinds of questions. As we both know from our work and just from life, Alzheimer's and dementia is huge and becoming huger all the time.
Absolutely.
And so a cognitive baseline for a doctor might be very, very helpful if that person has dementia at some stage of the game.
Sure.
Or maybe they're showing signs and it's real early and we want to try to get on top of something.
Absolutely, early intervention.
Exactly. We know that that's optimum. We know there's no cure for Alzheimer's dementia, but early intervention can help.
Absolutely.
So in that first welcome visit, as I said, it's going to be, if you will, a more cerebral visit. They're going to be asking you a lot of questions, and it builds a picture of you so that doctor knows better how to treat you throughout the year. And I just think it's a great resource and a great benefit that everybody should take advantage of. Then to follow up from that, there's an annual wellness visit, which I think is even better because you've got this baseline now, and the doc is going to be able to say, wow, this has changed.
Yeah.
For the better or for not the better. And either way, we can look at it and decide how to go forward. So those kinds of issues are what you're going to find at those 2 visits. And then you have the annual wellness visit then 12 months later.
Sure.
And you do that once a year. And of course you're seeing your medical folks in between time, but these visits are very specific to what I've discussed, and for the most part they are no cost to the person, to the beneficiary. And I like to say, just remember that if you're in one of these and the doc finds something and says, oh, we have to do this test or that test immediately, that isn't covered under a wellness check.
Sure.
But for the most part, if you're just doing that sort of baseline building, it's going to be no cost to you. You don't even have to use or paid your deductible yet. As a Medicare beneficiary, you can just have it done.
That's wonderful. Some of those baseline visits are so important for, showing us that raw data. My cholesterol's gone up or down, my blood pressure has gone up or down. Sometimes we need those numbers.
Right.
I know I do, to check in every year.
Yes, and it isn't always that they're bad numbers either. It's very encouraging for a person to hear that they're doing well and they want to continue to do well. And some of the other wellness benefits or preventive benefits available, breast cancer, colon cancer, diabetes screenings, nutritional screenings. I mean, there's so much. Didn't bring my list today, which probably our viewers are happy for, because I usually read that whole list in a boring voice. But there are so many, and if you want to find out about them, you can call a SHIP counselor, or you can go online and go to the Medicare website and find out.
Those are so important. It's just such a great thing to make sure you're keeping a look on every year.
Right.
And I assume probably some vaccines are included in
Exactly.
that list too.
We're talking about the flu vaccine, pneumonia, shingles is another. There's a couple of different shingles vaccines out there right now. Talk to your doc. Don't wait until you get it. And it's not a cost.
Sure.
There's no cost. And so there's very little cost to any of these. There's really no reason not to do these.
Absolutely. So I know we've mentioned those SHIP counselors at least 100 times today, and we probably should have mentioned them 100 more because they're so amazing.
Right.
I just want to quickly cover what do they do? What is it that you're going to receive when you call a SHIP counselor?
Okay. Well, first of all, you're going to have a person who out of the box understands how complicated all this is.
Yeah.
So there's no judgment, there's no frustration, there's no impatience. This is a person who simply wants to help you walk through the maze. Everything you tell them is confidential unless you say differently. There is nothing to sell. That person isn't going to say, sign up for plan A, plan D, whatever. They're going to give you the information, you make the decision, but they're going to give you info that you might not have thought about.
Sure.
So they are an advocate through and through. They will be there if there's an issue later. Maybe a choice you made didn't go like you thought it would. They may be able to help you, but they're always there for a conversation about how to deal with those benefits.
That's so amazing. They're such an important resource.
They really
and they're
are.
local. You get someone in your part of the state.
Yep.
So
and they love their jobs so much.
That's wonderful. Kimmy, thank you so much for joining us today.
Sure.
Thank you for staying tuned. We really appreciate it. Make sure you call those SHIP counselors. You're going to want to know the information that they have to share for you, and put 3 months before your 65th birthday on your calendar at home, because you're not going to want to miss that enrollment period. Thank you for staying tuned. And once again, call those SHIP counselors.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.